All right, hi. So good morning, everyone. My name is Shaun. I'll be talking to you about age-related macular degeneration. All right, so my colleague just now, Dr. Daniel Ting, has already explained the diabetic retinopathy. So his condition is also related to the retina. Mine in particular is related to the macula. So before we start, I think it's important to know our bearings within the eye. And the area of interest in this talk. So here in this diagram, you can see right on the left corner, you can see the cornea. Around the middle, you can see the lens. As we age, the lens will become more opaque and become cataractous. In the right smack in the center, you can see this huge pink structure, and that's actually the vitreous gel. And then at the back, you can see the retina, which then forms up the optic nerve. All right, so when you look into the mirror, you're actually looking at structures in the front, mainly the cornea. Now, so the macula is actually a specific region in the retina, and it gives us clear, fine vision. So in particular, there are two types of AMD that I'd like to draw your attention to. We have the dry AMD and wet AMD. So although dry AMD accounts for about 90% of all AMD cases, wet AMD accounts for 10% of. The thing is that 90% of central visual loss is actually attributed to wet AMD. AMD does not cause complete blindness, but losing your central vision can make it difficult to see faces, drive, or do close-up work, including cooking or fixing things around the house. So wet AMD is visually threatening, as I've already mentioned just now, and is a result of the growth of abnormal leaky vessels into the retina. And this causes an accumulation of fluid within the retina, which results in blurred vision. So are you at risk of AMD? I like to think of risk factors as what I can change and what I can't change. So what I can change would be modifiable risk factors, and non-modifiable risk factors are things that I can't change. So non-modifiable risk factors are those two at the top, including age of more than 50 years old and a positive family history. Modifiable risk factors are those listed below. So I would advise patients to avoid cigarette smoking, or if possible, don't start, to maintain healthy blood pressure and cholesterol levels, maintain a good BMI, and also have a regular balanced diet with antioxidants. How do we diagnose wet AMD? So like my colleague Daniel mentioned, patients with age-related macular degeneration, what we usually do, we'll perform a complete dilated examination. We may take a photograph of the retina, as seen here in this photo. All right, and then we will then do a cross-sectional imaging of the retina, as you can see in the photo on the bottom right corner. And this gives us good resolution of the retinal layers and whether there's abnormal structures over there. All right, and then after that, we will then perform an angiography of the retina. And some of you might think of this as a test of blood flow within the retina. Let's put things into perspective. So a person with cataract may visualize something like this, all right, and you can see here that the print is hazy or it's lacking contrast. But what exactly do patients with wet AMD experience? So to patients with wet AMD, their vision may appear distorted, parts of words may be missing, and this slide may actually also show you what they see. So they will say they can't see objects clearly as the first image, all right? And the second image, lines may appear distorted and wavy. And in the third image, you can see that there may be central areas in the vision where it appears slightly darker or even complete darkness. And as such, what do we need to do now? In essence, we need to start monitoring our vision, and if there is wet AMD, then we will start treatment. So just to give you some examples of how you can do monitoring. If you are in our clinics for AMD screening, we would suggest the use of an Amsler Grid. So the Amsler Grid is this box on the right, okay, and it has vertical and horizontal lines with a central black dot in the center. And we will actually ask our patients to cover one eye and then to test the fellow eye. So we'll ask them to look at the central black dot and focusing at the central black dot, we'll ask them if there are any areas that are distorted, lines that are wavy, or that they can't see clearly. So a person without any problems will see straight lines as the image on the left, but a person with wet AMD will see portions of the grid that appears blur like that on the right. Or lines may appear wavy, as I said just now, and that portions of the grid may appear distorted. So what happens if you don't see an eye doctor and you'd like to check yourself? So you can use simple visible items that you see every day, such as bathroom tiles or window panes with straight lines, both horizontal and vertical, and cover one eye to test at each time. Now, as for the treatment of wet AMD, our aim is really just to reduce visual loss and to maximize peripheral vision. So age-related macular degeneration of the wet form typically causes central visual loss, as I mentioned just now, and peripheral vision is typically intact. So our treatment is aimed towards reducing central visual loss. And for advanced or poor prognosis cases, such as that where there is already a scar and we know that visual prognosis may not be as good, we may choose to observe. So we must be reminded that once central vision is affected, we can only reduce further damage, and any improvement in vision is actually a added plus. Okay. As for treatment options of wet AMD, there are a few treatment options available. These include intravitral injections of a particular drug called anti-VEGF agents into the eye. You can perform laser and photodynamic therapy. So what happens if a patient with wet AMD decides not for treatment? It has been shown that after 2 years, patients who did not receive treatment on average saw 20 fewer letters compared to those who received injections. So you can see the image on the left showing patients without treatment and on the right with treatment. All right, so 20 fewer letters, to put things into perspective, is actually an equivalent to about 4-line decrease. All right. So here's a schematic of intravitral injections, and you can see that the needle and the medication is directed towards the gel within the eye. So in particular, I'd just like to show you how intravitral injections are done. First off, we would begin by cleaning and draping the eye and then putting on a speculum, which is a thin metal structure that prevents eyelids from closing when we're performing the procedure. We will then ask our patients to look directly at a target. In this case, would be our nurse. And then we'll perform the injection, which takes less than 5 seconds. This procedure is generally tolerable. In fact, we do have many elderly patients coming in for intravitral injections, and at present, it is actually the gold standard of care. Okay. Most times, injections occur without much issues. For sometimes, when patients do the injections, they may get a little bit of redness and bleeding on the superficial aspect of the eye, but if vision-wise is unaffected in terms of maintaining vision, and the eye is not extremely red or painful, most of the time it should be okay. And these can be analogous to, like if you were to fall down and have a bruise, and after a week or so, it should clear up. However, we would advise our patients, those who have received injections, that, if they have severe pain and the vision is very blurred, more so than before they came to see us, we would advise them to come in immediately. So I'd like to touch also on the other treatment option available, and that is actually PDT, which is photodynamic therapy. And this was actually useful in the past as a single method of treatment. However, now this is more so done in combination with injections, and the aim of this is to stabilize or reduce the visual loss. All right, so with that, I've come to the end of the presentation, and thank you for your time. I will now take some questions from the public. All right, so I don't see any additional questions now. All right, my colleague Daniel has answered some of the questions. So I have a patient here. I have a person who has actually asked, so can AMD be cured? So AMD, wet AMD, what we can do is actually to control the condition. However, at present, there is no cure. So you can think of this like diabetes. In diabetic patients, what we do is we control their condition. However, at present, there is still no cure for diabetes too. So similar to AMD, what we can do is to control the condition, stabilize the vision, but there is no cure. And another person has asked, apart from age, what are the other risk factors? So if you actually went back to my slide just now, you can see, I'd like to keep it simple and think of things that I can change and things that I can't change. So in terms of risk factors, AMD-wise, we can think of it as modifiable and non-modifiable. So non-modifiable risk factors includes things like age and family history. So if any of your relatives or your immediate family members have got AMD, that already puts you at risk. Modifiable risk factors are things that I know I can change. And so these would include things like avoid cigarette smoking. If you are smoking, try to cut down. Having a healthy diet with green leafy vegetables and balanced diet. And a diet also that is with antioxidants available. All right. And also control other medical conditions such as high blood pressure and cholesterol. Okay, those have been shown to be associated with age-related macular degeneration. Is there any treatment for dry AMD? I have a question over there. So if you you would have probably read about some reports saying supplements, eye supplements for AMD. So yes, there is actually supplements for AMD, and these supplements are found to be useful in the intermediate AMD patients. So just now I mentioned about dry and wet AMD. There is another classification where we think of AMD as early, intermediate, or late AMD. So in late AMD, patients typically have reduced vision. Okay, for intermediate AMD cases, sometimes patients may not experience any visual disturbances or symptoms. And in a large study that was done about maybe 10, 20 years back, across about 3,000 to 4,000 patients, they found that patients with intermediate AMD, when they take eye supplements, which includes lutein, xanthin, zinc, and vitamin C and E, they found that they were able to reduce their risk of progression to wet AMD by about 25%. All right, so in terms of treatment for dry AMD, our aim is really just to reduce the risk of progression more than treatment per se. Okay, another person has asked, what's the difference between AMD and glaucoma? All right, so glaucoma, in essence, is actually a problem related to the nerve. All right, and the main risk factor for glaucoma is eye pressure. All right, so in patients with glaucoma, typically they may experience that their peripheral vision is actually impaired, and this will then lead to constriction of the visual field, and in the later stages of glaucoma, central vision is then affected. In AMD, however, central vision is affected. In very severe cases where bleeding occurs and it bleeds into the gel, then only peripheral vision may be affected. But just bear in mind, these two are completely different conditions. All right, and glaucoma, the main modifiable risk factor is eye pressure, and hence most of our glaucoma doctors here, what they try to do is they give you eye drops to control the eye pressure, and if it doesn't work, they may suggest other adjunct treatment, which may include laser, and if it's still not controlled, even with either medications or laser, they may then opt for surgery. Okay, so I have a person who asked about Epi Retinal Membrane and what should the treatment be. All right, so An epiretinal membrane is actually a membrane that overlies the retinal layers. Okay, and this membrane is actually just beneath the vitreous gel, and patients may experience distortion, wavy lines, and vision may not be as good. In terms of the treatment, so I think what we should note is that, if vision is severely affected, they are blurred. If they have symptomatic visual disturbances and wavy lines, then the treatment for epiretinal membrane would be to remove the membrane, and that would involve doing a surgery, which is called a vitrectomy surgery, and we will then go into the eye, remove the vitreous gel, and at the same time then peel off the membrane. At most times, a lot of us, do have idiopathic, which is, there is no reason associated to epiretinal membrane, and in most times that can be left alone if vision is not severely affected and patients or people are not symptomatic in terms of having wavy lines or distortion. All right. So I have someone else who has asked, is the Amsler Grid able to pick up all cases of AMD? So the purpose of the Amsler Grid is really to identify areas of distortion and decreased vision. However, we do note that the Amsler Grid has got its limitations. So the macula actually serves about, at the most, a 20 degree of our central vision. So in AMD, if the cause of if the lesion that we're thinking about is outside of this central 20, 30 degrees, sometimes the Amsler Grid may not be able to pick up AMD. But we must bear in mind that age-related macular degeneration in particular is a macular condition. All right. So as much as we try our best to tell our patients, monitor with an Amsler Grid, we do have some cases that would fall outside of this screening modality. So someone asked can I go blind if AMD is not treated in time? So based on our natural history of AMD, of wet AMD in particular, as I've mentioned just now, in 2 years, patients who are not treated, wet AMD patients who are not treated will experience 4-line decrease, which is equivalent to about 20 letter decrease as compared to someone who is treated. All right, so in the late stages of wet AMD in particular, scarring occurs, and if this scarring involves the central vision, then vision can be affected, and typically central vision. So as I've repeated myself, basically AMD affects central vision, peripheral vision is not affected. So yeah, okay, and I have dry AMD, will I get wet AMD at a later stage? Well, most cases of dry AMD do not progress to wet AMD. But as I mentioned just now, monitoring yourself with an Amsler Grid, or in recent times, we have mobile applications that we can use to help to track central vision also. And if you notice any distortion or any impact to your central vision, then yes, come in and let us have a check. So I've just answered that question on whether there are other ways to detect AMD besides the Amsler Grid. I can let you know, so actually some of our patients who have come into SNEC, we have suggested for them to use this application called the All Eye application. It's actually an application that helps our patients to track central vision. So you can treat this like a game, and it involves moving an object on your mobile phone or tablet devices up to a line, and that will enable them to track central vision. I have a specific question here on retinal schisis, okay, which is, as the person has correctly mentioned, splitting of the retinal layers in one eye, and the question is whether the other eye can be affected. Well, yes, the other eye can be affected, but to determine whether a patient has retinal schisis, you will need to actually come in for a complete eye check. All right. I have someone who mentioned how many times does a patient with wet AMD need to do eye injection? So in recent times, there are more and more evidence that suggests that treatment with intravitral anti-VEGF injections have been found to be effective. Typically, we would advise our patients that in the first year, you may need up to 7 or 8 injections. And as the years go on, if we can maintain stability, we may choose to then opt for a more modified and individualized approach, meaning we would then slowly treat and then we'll extend the interval, and finding a stable interval, we will then suggest we can stick to that interval. It can be up to 4 months or even as needed basis. Okay, I think with that I've come to the end of the presentation. Thank you very much for your time.